Good morning, everyone.
Morning.
Morning. It's very nice to see you all again. My name is Anthony Carlisle. I'm one of the board members of Taiwan Aid, and I'm also the Supervisor for International Affairs at the Garden of Hope Foundation, Li Xin Jijinhui. So I'm very pleased to be back here again with you all this morning. Today we're going to start with the topic of the impact of COVID-19 on partnerships between government, private sector and civil society. Yesterday at the conference we had a very full and a very rewarding day of discussions about the issues of international development with partnerships between NGOs and the corporate sector, especially in light of the COVID-19 situation. We heard that partnerships between corporations and NGOs can flourish if NGOs can take on the innovation and the entrepreneurial skills of the corporate sector, but we also heard warnings that there is a danger of a commodification and a profitization and commercialization of international development. On the other hand, with cooperations with governments, we heard advice about how NGOs can better adapt to work together with their governments. And we also heard how, especially with the recent pandemic situation, investment in international development had been impacted and is still generally low. Governments do not spend enough on international development, and they spend even less, they invest even less on international development through NGOs. So that brings us to today's topic at this very important moment. In light of the COVID situation, how can we strengthen the partnerships between governments, private sectors, and civil society to work on the issues that have been highlighted and really come to the fore after the COVID-19 situation. So we have a very distinguished panel this morning who'll be speaking to us. Hopefully, we'll have more time after this, at the end of this session, to answer some of your questions. We didn't get much time to have Q&A yesterday, so I hope that today we'll have more questions and more chance for discussion at the end. So let me introduce you to all the panelists now. To my right, I'm very pleased to have Dr. Chien-jen. He's a former Vice President of the Republic of China, Taiwan. He's and currently serves as a Distinguished Professor at the Genomics Research Center at Academia Sinica. We also have Ms. Jaeeun Shin, who's the Director of Policy Education Center at the Korea NGO Council for Overseas Development Cooperation, KCOC. And we have my good friend, Ms. Cindy Southworth, who's the Women's Safety Policy Manager at Facebook and also serves on the Board of Directors of the Global Network of Women's Shelters. And we have Doug Rutzen, who's President and CEO of the International Center for Not-for-Profit Law in the USA. And finally, we have Dr. Soawapak Hinjoy, who's the Director of the Office of International Cooperation, Department of Disease Control from Thailand. So without further, can we see all our speakers and we can make them wave to us? There you are. Can you give us a quick wave? Hi. Hi. We'll be hearing I'm looking forward to hearing from you soon. But we'll start today's session with a speech from Dr. Chen. So as I already said, Dr. Chen is the former Vice President of Taiwan. He's a Distinguished Professor at the Genomics Research Center at the Academia Sinica, as well as his distinguished career in academia. He's an epidemiologist and also, of course, human genetics expert as well. He received his education at Johns Hopkins University. Previously, he served as the Minister at the Department of Health, Minister of National Science Council, the Vice President of Academia Sinica, and he was elected the 14th Vice President of the Republic of China, Taiwan, and he just stepped down this year. He was a very popular Vice President, and we felt very lucky and blessed to have an expert in epidemiology during the COVID-19 crisis, And Dr. Chen was praised for Taiwan's and received a lot of credit for Taiwan's response to the crisis. So without further ado, I'd like to ask Dr. Chen to take the stage.
Thank you very much. Thank you very much. It is really my pleasure and honor to give a talk on this COVID-19 containment and economic revitalization in Taiwan. And as we all know, as of October the 2nd, in the whole world, there's more than 34 million confirmed cases in the world and more than 1 million deaths. In the United States, there are 7.4 million confirmed cases and more than 200,000 deaths. And in Taiwan, there's 517 confirmed cases, with most of them were imported cases, and only 55 are locally infected cases. And we have 7 deaths. The case fatality rate is 1.4%. And compare the COVID-19 incidence and mortality rate per 100,000 population in the world and Taiwan. And as you can see that in the world, the incidence rate is 446, mortality rate is 13 for the world. For the United States, the most severely affected nation, the incidence rate is 2,238, and mortality rate is 34 per 100,000. And Taiwan incidence rate is 2.2, and mortality rate is 0.03. In other words, the incidence rate in the United States is 1,000-fold of Taiwan, and mortality rate is 2,000-fold of Taiwan. And indeed, there's a global failure in pandemic containment policy. The first one is inadequate contact tracing and tracking resulted in the outbreak and city lockdown in Wuhan last December. And unfortunately, the disease spread out. And there's a postponed announcement of public health emergency of international concern from World Health Organization in January. And there's resulted in some delayed border control of passengers from epidemic areas in February. And there's insufficient track and trace system to identify close contacts. And also, a lot of countries carry out the city lockdown, however, without the promotion of personal hygiene, social distancing, and avoidance of large-scale gathering. And mass screening was carried out in many countries, but without enforcement of 14-day isolation and quarantine. And there's a shortage and public panic buying or hoarding of PPEs, and there's a limited response to disinformation, dissemination, and lack of professionalism and political neutrality. Due to this global failure in pandemic containment policy, so it results in a severe effect of everything in the world. And in Taiwan, we have a very severe SARS outbreak in year 2003, and we carry out a reform of our epidemic prevention system afterward. And we have amended this Communicable Disease Control Act and the relevant regulation, and we reorganized our Ministry of Health and Taiwan CDC, and we authorized this Taiwan CDC has the right to designate healthcare institutions to function as responding or isolation hospitals. And we also enhance hospital infection control through accreditation, and we standardize our procedures for communicable disease surveillance and reporting domestically and internationally. When we also optimize the border quarantine procedures, and we recruit and train a lot of infectious disease specialists in our Taiwan CDC. And last but not least, we established our National Health Command Center. And last December 31st, when our Taiwan CDC experts noted there was a cluster of atypical pneumonia cases in Wuhan, we immediately sent reporting emails to inform WHO and China CDC, and we also started our onboard quarantine of passengers from Wuhan. And from this January the 2nd, and up to this January the 7th, we carry out a series of procedures, try to have early detection of these cases and have a very good case reporting system. And also, we request to send two experts to Wuhan to have an on-site visit. And as you can see, this is the reporting email to WHO on December 31st last year. And unfortunately, we did not get any further response from WHO. They just sent us a note that, yes, we received it, we will send it to relevant colleagues, and that's the end. And if you look at this map, and you can see from the map that before, that's on January 1st of 2020, there's already a lot of patients has been hospitalized and treated in Wuhan's hospital. Unfortunately, those cases with mild symptom or asymptomatic, they were not hospitalized or isolated. They was went out freely and to spread out the virus and cause this a large outbreak in Wuhan. So the early detection of the cases and very well isolation of this close contact of patient is necessary to contain this COVID-19. And we always say that the best thing is to put out the fire at the beginning. Unfortunately, we did not do that. And I think this transparent policy making and interministerial effort is what Taiwan have been doing. And on this 15th of January, we classified this COVID-19 as the classified infectious diseases. In other words, they have to be reported once a physician or a medical institution identify the diseases. And also, that's on this 28th, we activate our Central Epidemic Command Center, and on the 22nd of January, our President Jaeeun held an emergency meeting of Taiwan National Security Council, and WHO also held a meeting. Unfortunately, they did not declare PHEIC until that's on 30th of January. And Taiwan's successful model are based on 5 important elements. That's the prudent action, rapid response, early deployment, transparent information, and good citizenship. And with regard to the rapid response to pandemic, we have no city lockdown, no mass screening, but we use a lot of ICT and AI technology for the rapid response to pandemic. We use this ICT and AI technology to carry out a very prudent surveillance of pandemic status in Taiwan as well as internationally. And we also quickly announced this travel warning, use the cellular broadcast, and we have a very stringent border control using e-quarantine system. And we have in-depth tracing of close contact of confirmed cases, use ICT and big data analysis, and we enforce the home isolation and quarantine for close contacts and inbound passengers using digital fencing, tracking, and line bar system. And as I mentioned that we don't have mass screening, but we carry out precision screening of suspect with symptoms and signs. We consider this is more effective and efficient. We also mobilized our healthcare system for isolation treatment of confirmed cases. We mobilized 20,000 isolation rooms and 40,000 ventilators. Fortunately, we did not use many of them. And we also enhanced the hospital infection control using the disinfection and delivery robots. And this is the border control. I want to show you that on this 11th of February, we already prohibited the nationals of China, Hong Kong, and Macau to get into Taiwan. And on the 19th of March, foreign nationals prohibited from entry without special permission. So we started our border control quite quickly and also very carefully in order to prevent any possibility of this imported cases. And once this inbound passengers get into Taiwan, they have to get this health check before boarding. and also have our onboard quarantine and announcement, and they have to fill out this APP, the quarantine system for entry, and then they will get a home quarantine notice, and we also carry out a fever screening and symptom check. If they have any kind of compatible symptom and sign, they were sent to the hospitals using the ambulances for isolation treatment. And if they are healthy and no problems, they were sent to home using the designated taxi and rental cars. And they have to be home quarantined for 14 days. And as you can see here, if for inbound travelers, they have to be home quarantined for 14 days, and close contacts of confirmed cases have to be home isolated for 14 days. And we use electronic security monitoring system to track the location and health status of people subject to quarantine or isolation. And these are the quarantine system for entry. We have a Chinese and also English version. And this is a home quarantine check-in system. And people have to fill in their health status every day. And then if they have any kind of support or care need, and they can use this live bot to have communication with our disease containment experts. And we also use this digital fencing check-in system to see whether the isolated or quarantined people went out of the range of this quarantine. Then we can inform him or her to go back to his home or her home. Of course, if we want to ask a person to be quarantined for 14 days, it is very difficult for them. And so we have to provide care and support services. This includes if they have anything, need help, they can call us on the local government hotline, and we have meal and grocery delivery. We help them to do garbage collection. If they don't have adequate room at home for quarantine, they can go to this designated settlement area for the quarantine. And if they need any kind of help, we may send someone to have a family visit. And with those, we have the diseases, and they will be sent to this designated hospitals for health care. And in total, we quarantined or isolated around 300,000 people. And how many of them has violated the regulation? In total, we find that's less than 1,000. That's 932 person has got a penalty. In other words, only 0.3% of the quarantined and isolated people, they did not follow the regulation. And 99.7% of isolated and quarantined people, they comply to government's guideline very well. So we have to thank these 300,000 unsung heroes. They sacrificed their 14 days freedom, and then in turn, 23 million people in Taiwan can live normally, can go to school normally, and can go to work normally. And with regard to the early deployment for COVID-19 containment, I would like to share with you that our Central Epidemic Command Center carry out a daily press briefing to announce transparent information, health education, and risk communication, and help people to resist the disinformation attacks. And we also provide adequate supplies of PPE and other medical materials through mass production and name-based e-rationing. We enforce the personal hygiene, social distancing, and avoidance of large-scale gathering using online education and self-broadcast. And also, we use e-allocation system to carry out our financial relief and economic stimulus. And we also carry out research and development of rapid diagnostic, antivirals, and vaccines, as well as we engaged in international collaboration on PPE, pharmaceuticals, and technologies. And I would like to share with you our national mask team. It's an international champion cup. We requisitioned 73 factories to expand the 92 production lines, and average production per day increased from 1.8 million in January to 21 million in May. So we have adequate face mask supplied after May. And before then, we definitely have a very good distribution system to assure that everyone in Taiwan can get a face mask at a very reasonable, low price. And we use our national health insurance card to have this name-based distribution system to assure everyone in Taiwan may have this face mask for daily use. And after May, since we already have adequate face mask, and we consider that we have to help the health personnel in all the whole world if they need our help. So we donate more than 54 million masks to Europe, USA, our diplomatic allies, and more than 80 countries in the world. And we also enforce this health self-management. We urge people to wear surgical masks when coughing and sneezing and wash their hands thoroughly with soap or sanitizer. And we urge them to avoid crowded places, including hospitals, temples, church, and so forth. As Taiwan is a multicultural nation, and there's a lot of immigrants here and also a lot of migrant workers here. So we definitely have to announce this kind of information using 7 languages for all the people in Taiwan may have this kind of education information available. And we announce our social distancing measures on April 1st, and we ask people to keep 1 meter away outdoor and 1.5 meters indoors. And also, in the crowded area, we urge people to wear a face mask. And people complied to these guidelines very well. I have to thank another 23 million unsung heroes in Taiwan. They follow this government guideline very well. And during this period of time, I would like to thank a lot of NGO. They also help government to educate the people and also to urge the people to follow the government guideline. And we use our national health insurance database to help this kind of COVID-19 containment. And in Taiwan, we use this kind of system to identify patients with this symptom and sign compatible to COVID-19 and also merged with travel history and to urge these people to go to hospital for this further COVID-19 testing. And this is so-called targeted or precision testing. And our Taiwan AI lab also developed a lot of platforms for social distancing, for healthcare report of this quarantine people, and also for this chest X-ray reading, this classifiers, and also trace this virus strain. So we use a lot of modern technology to contain this COVID-19 and to do this financial relief and economic stimulus. And I would like to share with you that COVID-19 indeed affects almost all sustainable development goals proposed by UN: no poverty, zero hunger, good health and well-being, quality education, gender equality. You can see that almost all SDGs were affected by COVID-19, except, I myself points, life below water and life on land. So I think that a lot of NGO were also affected during this period of time. And the COVID-19 have a very significant impact on this industry, and we are going to move in a new digital world. And COVID-19 accelerated digital transformation in Taiwan and the world. Online consumption has increased to 1.8-fold. We expect to take 2.5 years to do it, but within only 6 months, we already have a very significant digital transformation. Since there's a lot of shock industry, including the transportation, tourism, physical entertainment, physical retail, and food and beverages. So we consider that we definitely have to have a financial relief to this severely affected industry. So the government allocate 210 billion NT dollars for epidemic control, financial relief, and economic vitality. And we shift the government spending priority to emergency measures. And we also increase the government investment and procurement for expansion of domestic demand. We accelerate private investment and try our best to maintain foreign exchange market stability and stock market momentum. According to this, the ranking of COVID-19 control in 75 emerging and frontier economies published by Bloomberg Economies, and as you can see, based on this three indices, there's a confirmed deaths from COVID-19, level of activity compared with pre-virus normal, and policy space available to counter the damages. And according to this ranking, Taiwan was ranked as the #1, followed by Botswana, South Korea, and Thailand. And Newsweek Japan also published an assessment of response to COVID-19 in 49 countries based on the epidemic damages and economic damages. The total score is 200, and Taiwan got 180, and is also ranked as the #1, followed by Malaysia, Hong Kong, and Thailand. And most recently, our work in data published by this Oxford Martin School, they assess the percentage decline of GDP in Q2 of 2020, and Taiwan has the lowest economic recession, minus 0.6%, followed by Korea is minus 3%, and Peru have the worst economic recession, around 30% decline. And if you look at these figures, Taiwan has the lowest economic recession among all the 38 countries, and also have the lowest mortality from COVID-19. And so the Taiwan have good containment of this outbreak is based on our Taiwan value, and that's the democracy, transparency, and solidarity. From the very beginning of the pandemic, I just mentioned that our government has ensured that the public has the open access to COVID-19 information, and CCC has held daily press briefings since January, and which generate accurate news across a broad spectrum of media outlets, and CCC quickly established its authority and earned the trust of the public. And public trust has had a stabilizing influence on society, encouraging citizens to follow government guidelines and rules, and making the public less vulnerable to disinformation campaign. So it generates a virtuous cycle. The more the public trust, the more people are willing to cooperate. And we all know that transparency and public trust are natural products of our vibrant democracy in Taiwan. And while 25 select the people who are making things better and identify as President Jaeeun and also Digital Minister Audrey Tang and myself as the one who helped the containment of the COVID-19. However, President Jaeeun said that it is not the trio, it is the people in Taiwan. Solidarity is the key for the success of COVID-19 containment in our country. And President Jaeeun was also elected as Time Magazine's 100 influential people, and U.S. Senator Ted Cruz said, "Freedom is Taiwan's North Star," which has been clear in the midst of the COVID-19 pandemic. Taiwan has proved that the virus can be controlled without emulating China's drastic policy. And President Jaeeun responded by thanking everyone in Taiwan because they are the hero for their efforts in combating COVID-19. In the future, there's still a lot of challenges, this including this seasonal influenza, and also this global economic recession. And I think that we have to live in a new normal lifestyle during this COVID-19 pandemic, keep social distancing, keep very good personal hygiene, have a name-based gathering, and so forth. But viruses respect no border. Any pandemic or emerging infectious disease is detrimental to global health, economic development, social stability, national security, and regional peace. No country can fight pandemic alone, so we have to help each other, and this is the key for the success of pandemic containment. Excuse me. And in conclusion, I would like to mention that there are 5 important components for the successful containment of COVID-19 in Taiwan. That's the prudent action, rapid response, early deployment, transparent information, and good citizenship. Finally, I would like to read a message from our Holy Father, Pope Francis. I think it is very beautiful. And rivers do not drink their own water, trees do not eat their own fruit. The sun does not shine on itself, and flowers do not spread their fragrance for themselves. Living for others is a rule of nature. We are all born to help each other, no matter how difficult it is. Life is good when you are happy, but much better when others are happy because of you. Let us all remember then that every changing color of a leaf is beautiful, and every changing situation of life is meaningful, and both needs very clear vision. So, do not grumble or complain. Let us instead remember that pain is a sign we are alive, problems are a sign we are strong, and prayer is a sign we are not alone. With that, I would like to thank you, everybody, for your attention, and we hope that in the near future, we have a global solidarity and to control the COVID-19, and Taiwan can help, and Taiwan is helping. Thank you very much.
Thank you very much, Dr. Chen, for that very interesting speech about the Taiwanese government's response to the COVID-19 crisis. And thank you also for mentioning the unsung heroes of quarantine. I recently came back from the UK, so I was at home for 14 days as well. So, but now no longer unsung, so now I've told you all about it. Yes, as you said, as you quoted the Pope, change can be good, and good things can come from change. So we're in a very changeable world. We're in interesting times, changing times, but there are opportunities to change things for the good as well. So with that, I would like to turn to our second speaker. We heard from Dr. Chen that Korea is another country that certainly in terms of the way it's responded economically to the crisis, Korea has done quite well in the second quarter, coming out number 2 in economic performance in the world. Our next speaker is Jaeeun Shin, and she is the Director of Policy Education at the Center in Korea for NGO Council of Overseas Development Cooperation, or KCOC. She specialized in international development cooperation with a particular focus on civil society, and she's worked in development CSOs for more than 20 years. As well as her various research projects, she also has teaching experience in international development of NGOs and their various activities, including at Seoul National University and the Korean Christian University. So without further ado, I'd like to hand over to Jaeeun.
Okay, thank you. Thank you, Anthony. Good morning, good afternoon, good evening, everyone.
Could you speak a little bit louder, please?
Can you hear me?
Yes. Yes, we can.
Okay, thank you, Anthony.
Thank you.
Good morning. Yeah, it's good? Now it's good?
Yep, perfect.
Okay, thank you. Good morning, good afternoon, good evening. Thank you for inviting me to this forum and for giving me the opportunity to talk about Korean experiences. Today, I'm going to talk about how have Korea...
Oh, sorry, Jaeeun, could you hold the microphone just a little bit lower? You're kind of blowing into the mic a bit. Just a little bit low, below your mouth.
Okay.
A little bit down.
It is...
That's it, yeah.
Okay.
Good, yeah.
Okay. Today, I'm going to talk about...
我这样会喷麦。
Is it okay?
Okay, yeah, maybe you better move the mic back.
Okay. I don't use my microphone. So is it okay for you?
Yes, that's fine.
Okay. So today I'm going to talk about how have Korean CSO responded to COVID-19 and partnered with the Korean government in the context of COVID-19. Next. So the contents are divided in 5 parts. First, I'm going to present South Korea's and global COVID-19 situation and responses. Then I share with you responses from Korean Development CSOs, KCOC, my organization, and the Korean government. Finally, I'll discuss issues, dilemmas, and challenges. Next, please. Next. Before I begin my presentation, I introduce my organization briefly first. KCOC, Korea NGO Council for Overseas Development Cooperation, is an alliance of more than 140 NGOs working for international development, relief, and humanitarian assistance. Our member organization implement projects worth 70 billion Korean won, approximately 48 million US dollars annually. KCOC currently represents the civil society on the Korean government's International Development Cooperation Committee and the Committee on the Operation of the Global Disease Eradication Fund. We try to enlarge our role to open a platform between CSOs and other stakeholders, such as the government, private sectors, and academy, as well as to advocate the voice from the field to be heard. Next. This graph shows the situation and responses to COVID-19 in South Korea and global level until July. You can also see the major response from Korean government and from Korean Development CSO, including KCOC. I'll try to make this a detailed explanation from next slide. Next. Since the outbreak of COVID-19, Korean Development CSO have been supporting 4 areas. First, promoting preventative behaviors, distributing hygiene materials to help the vulnerable protect themselves from the coronavirus, and sharing essential information so people in developing countries accurately informed about how to stay healthy. Second area, supporting the livelihood of the vulnerable groups, such as urgent living expenses, survival kits, etc. Third area, supporting psychological service, gender-based violence, fear, and isolation, etc. And fourth area is about education. Next. Now you can see the activities of our member organizations. First picture shows the activities in Bangladesh refugee camp from Save the Children. The second one explains medical personnel supply support in Morocco from Global Care. And the third one, next. And the third one is about food support in Zambia from Good Neighbors. And the fourth one shows the provision of education materials in Brazil from the World Vision. Next. KCOC response activities can be divided into 2 categories: capacity building for civil society organization and advocacy and campaign. Next. For capacity building for CSOs, first, we prepared knowledge sharing materials such as webinars. So KCOC supported the Korean development CSOs to accumulate knowledge of COVID-19 and to prepare a response plan for the project site. Next. The second one, we prepared experience sharing. The KCOC conducted online interviews with CSO activists remained in 14 countries, how the country's COVID-19 situation was, the government responses, the role of CSO, and the future plan. And we shared the videos on YouTube. Next. And the third, for information sharing, we published weekly country reports on current situation in 7 developing countries from April. In addition, we share relevant information, trends, research reports, and news. So CSOs can understand the situation and influence of COVID-19 not only in domestic level, but also international level. These materials help CSOs to prepare for future responses and activities of post-COVID-19. Next. Now is for advocacy and campaign. On April, we published the first statement, which was more than appeal than an assertion. In those days, because the coronavirus hit Korea severely, there was no atmosphere to help developing countries as we are forced to focus on domestic responses. Thus, we appeal to the Korean government and the public to pay attention to the response of the vulnerable in developing countries, and we request our government to establish a consultative body of government and the civil society on fighting COVID-19 in developing countries. Next. We continue to ask partnership in May again. Our second statement is that we propose and request external cooperation, including the government, businesses, and private fundraising agencies. Our proposal amounted to 64 countries, 62 billion won, Korean won, approximately $51 million, and 170 projects. Next. In addition, KCOC participated in the global campaign with A4SD, such as signing of a joint statement of civil society to the United Nations and the head of governments, and adding hashtag Stronger Together on the COVID-19 related SNS posts as well. Next. Next. As a result, the government decided to open a fund for the Public Civil Society Partnership Program for response to COVID-19. It amounts 8 billion Korean won, approximately 6.5 million US dollars in 2020. In particular, Ministry of Foreign Affairs and KCOC, Korea Aid Agency, put a lot of efforts into it. Next. Now, I want to talk about issues, dilemmas, and challenges. First one is effective partnership. Then how is the partnership between the Korean government and Korean CSOs? Partnership depends on the how the government perceives CSO. Korean CSO have been regarded as actor needed unilateral government support and regulation, and CSO participation has been either perfunctory or limited for 20 years. For example, next. Yeah, for example, the proportion of government's public-private partnership over the past 5 years have averaged only about 2 or 3% of the total ODA budget, even though the ODA budget has been increased continuously. This contrasts with the OECD DAC member countries' spending on average of 12% of their ODA budget. Next. Then the government-civil society partnership took a dramatic turn in 2018 when the government accepted the OECD DAC peer reviews recommendation for civil society partnership. As a result, our government prepared a policy framework for government civil society partnership in international development cooperation with the civil society in 2019. This framework contains role of civil society, principle of partnership, goal and objectives, commitment, implementation measures, and action for partnership. In this atmosphere, the government civil society cooperation, the COVID-19 occurred. As I mentioned before, we have continuously appealed and emphasized for our government to engage in the response to the global COVID-19 with the CSO. And it took 3 months to be realized the partnership. While there is a 3 month gap in cooperation with the government and civil society, I think the government's willingness and determination to cooperate this time clearly differ from the past. We hope this cooperation will serve as an opportunity to secure justification for expanding partnership with civil society in the future. Next. Let's see the partnership with the local CSO in Korean government and Korean CSOs. The KOICA, Korean aid agencies, local CSO support project began in 2012, but was suspended after the government CSO partnership have been in crisis between 2016 and 2017. Korea CSOs have continuously to ask to reopen the program, but it is not yet open. Meanwhile, Korea Development CSO partnership with the local CSO is being attempted by about 20% of the number of organizations, but the volume is very low level. So localization have become an issue that both Korean government and the Korean CSO should consider and pursue in the future. Next. Next. Let's move on to the second issue, ODA. The Korean government included the Korean COVID-19 response plan in its 2012-21 annual implementation plan for international development cooperation. Its strategy in 3 directions. First is to focus on health and medical ODA capability. And second, to strengthen economic and social resilience in the developing country. And the third, to establish ecosystem of leading global cooperation and win-win in development. Next. As you can see, the picture, COVID-19 is not a single issue, but a complex one with many problems involved. It affects not only health, but also all SDG. We need to apply whole of SDG approach In addition to solidarity and cooperation between the government and CSO to respond to the challenge effectively. From this perspective, the government needs to expand its perspective on COVID-19 response. It is also necessary to set the stage for monitoring and evaluation on the consequences of the Korean government support and intervention with civil society. In doing so, the government's global COVID-19 response will be supported by more people. Next, please. Today, I share response from the Korean Development CSO, KCOC, and the Korean government to COVID-19, and discuss issues, dilemmas, and challenges in Korean perspectives. We learned this disease cannot get through without cooperation and alliance with other stakeholders, such as government and private sector. Therefore, partnership is the key issue for CSOs, especially our efforts to make the partnership institutionalized is very helpful in this urgent cooperation need. We also realize that it is crucial to present ourselves not as an actor needing support, but as one to create leverage effect that multiplies impact. This is end of my presentation. I'm really enjoyed speaking to you today and hope this experience has been useful. Thank you very much for listening.
Thank you very much. Thank you, Jaeeun, from that presentation. I was very interested to see how Korean NGOs have lobbied, advocated with their government to come up with a policy to channel funding through CSOs to work on the issues of COVID-19 and other ODA projects. Although there's still a big gap, there's still much to do because only 3% of ODA goes to Korean CSOs at the moment. Okay, now we'll move on to our second speaker. I'm delighted to introduce my good friend, Ms. Cindy Southworth, who's the first head of women's safety at Facebook. Prior to working at Facebook, she was the executive vice president of the US National Network to End Domestic Violence, NNEDV, where she founded the Safety Net Technology Project. And she was also one of the founding members of the Global Network of Women's Shelters, where we serve together on the board of directors. I'm going to hand over the floor to Cindy, and she'll be talking about responding to COVID through partnerships.
Ni hao, good morning. And Shia, thank you so much for inviting me to join you today. I had the pleasure of speaking at a Garden of Hope conference in May of 2018 and also at the Fourth World Conference of Women's Shelters in November of 2019. And I admit that I would love to be there with you in person once we have gotten a vaccine and are past this pandemic. It's a beautiful country and I wish I could be there with you. For the past 27 years, I have worked to end gender-based violence at nonprofits, NGOs throughout the United States and also internationally. And 20 years ago, I founded our Safety Net Technology Project that looks at the intersection of technology and gender-based violence. Next slide, please. And as Anthony said, 11 years ago, I was a founding board member of the Global Network of Women's Shelters, and I'm honored to be able to remain in that position in my new role at Facebook as the Global Head of Women's Safety. For the past 10 years before I joined Facebook in my nonprofit role, I served on Facebook's Safety Advisory Board, where I gave them advice, talked about what women need, talked about violence against women. And so I had an inside look at how they approached women's safety. And so when this position became available, I was really honored to join Facebook and work inside the company to help the 3 billion users of Facebook Instagram and WhatsApp be safer and harness technology to reach safety if they're being abused. Next slide. So one of the things to know is that the Facebook mission is to give people the power to build community and bring the world closer together, just like we are doing today via video. But to bring the world closer together, all of our platforms must be safe. Every user has to feel safe on our platforms or they cannot build community. Next slide. So our safety team here at Facebook takes a 5-pillar approach, and we work on safety from a comprehensive manner. First, we build partnerships with NGOs, civil society, just like the Garden of Hope, the Global Network of Women's Shelters, my former organization, the National Network to End Domestic Violence. In fact, we work with over 400 safety organizations around the world to hear from experts about what's happening in the world, everything from health, wellness, suicide prevention, gender-based violence, because we know that our staff at Facebook can't know all of the things. The next pillar is we focus on policies. We know that we need to have community standards that guide how people use our platforms and how they treat each other on them. Our third approach to safety is tools. We build products and features that allow people to control their experience. I use them myself on Facebook. I use all of the content moderation tools. I decide who gets to see what I post. I keep some posts just for friends, some for everyone, some for just family members. So there's many different tools that we build to allow people to control their own experience. And then we build resources such as the Safety Center. We also have many guides. We have a guide for women at Facebook. We also have a guide for domestic violence survivors on Facebook. So those types of resources and training tools. And then our fifth pillar for safety is feedback. We know that we cannot do safety work without getting feedback from the community about what we're doing well and what we need to improve on. And we know that we're never going to get it right without feedback from the community. So we're constantly striving. Next slide. So when I mentioned the partnerships, we've actually done women's safety roundtables with over 200 women's safety civil society NGO groups around the world, and hearing from them what is most important to them, what their concerns are, what their issues are, and what we can do better. Next. And just a sample of some of those partners, the National Network to End Domestic Violence, where I used to work, many different organizations around the globe. We are a global company, therefore we work and we talk to global NGOs. We don't just talk to the nonprofits in the US. It's vital that we talk to people from every region. Next. So in terms of the COVID response, I am very honored to be here following two speakers, Dr. Chen, who from Taiwan and Korea, who have handled the pandemic incredibly well. And so we know that most countries in the world have not had such a stellar response. We know that victims of domestic violence and sometimes are trapped at home with their abusive partners during what the Secretary General of the United Nations has called the shadow pandemic. Because if you are stuck at home or have limited mobility because of COVID, domestic violence is so much more dangerous. It is hard to make a phone call, to call a helpline. It is hard to get away, to get to safety. You may not be able to go to work or school nearly as much. For the majority of the countries in the world that are still struggling with some form of lockdown or restrictive movement, it is very difficult if you're a victim of domestic violence. Next. So while I was in my previous role at the National Network to End Domestic Violence, I started working with Facebook on their COVID response. And so one of the things we put together was a realization that we were going to be transitioning a digital transformation, just as the VP mentioned. And that digital transformation in the gender-based violence space meant that counselors and victim advocates that had historically done most of their work in person had to switch very, very quickly to helping victims by video, by phone, by text, by email. And we had to figure out how to do that safely. So we put together some suggestions and tips on how to connect with survivors, how to still feel like you have that human connection, but to do it with some distance and some safety. One of the things we created is we built a COVID information center. It's a COVID information hub that has all sorts of information from the World Health Organization, from medical experts, but we also wanted to include in there tips for survivors of domestic violence. Next slide. So we partnered with the National Network to End Domestic Violence and UN Women to create tips for people experiencing abuse and tips for people worried about a loved one. And you can find those tips on Facebook by searching the terms domestic violence or domestic abuse, and you will see them. I've pasted them here in English, and also I changed my Facebook settings to be from Taiwan and then posted those screenshots here for you also. Next slide shows a little bit more about these tip sheets for victims and for family and friends. Next. We also partnered with the National Network to End Domestic Violence to distill some of those tips down to a social media friendly information image. This pink one here that took all of the same content but really distilled it down to just what is really key: safety planning, perhaps using code words, talking about a grocery store instead of a shelter, making sure that if you are overheard or the text is read, how could you ensure safety during COVID? Next. One of the things we did with the Global Network of Women's Shelters and UN Women early on is Facebook partnered with these nonprofits and UN Women to collect as many helplines as possible. And that's a complementary project because the Global Network of Women's Shelters has been collecting helplines since last November at the Global Network at the World Conference of Women's Shelters in Kaohsiung. But that website is not ready yet. So in the short term, Facebook said, if you just give us helplines, we will post them and people can search for help. And so that's available now. But what I'm very excited to share with you is that we convinced a team of volunteers at Facebook, engineers that are volunteering their time to pro bono build an interactive, robust database that will be global. It will allow NGOs to type their own information into the database, have their national network verify it and say, yes, this is accurate. They do serve survivors of gender-based violence, so that we know that the information in the database is accurate and verified. And it's information you would want to share with a loved one. And then that will be easy to maintain because every quarter, every 3 months, you'll get an email from the database saying, is your information still up to date? Do you need to change anything? Have you added services, maybe added languages that you provide counseling? And so that database is almost finished, and we will be, Facebook will be giving it to the Global Network of Women's Shelters quite soon. And then the GNWS will be reaching out to the world to say the database is ready for your information. Thank you so much for listing it in the GNWS database. Next. Another COVID initiative that we created is, we know that many people join Facebook private groups. These are places where you might join to talk about cooking or hobbies or hiking or athletics, you name it. And in those private groups, what we find is people disclose abuse. They share what's happening in their personal life. And the group administrators were quite worried and wanted to make sure they could help everybody in their group, especially if they were experiencing domestic violence. So Facebook partnered with UN Women and the National Network to End Domestic Violence to create some learning modules for groups. And then the group admins decide, I'm going to add this to my group and allow that module to be seen by all of my group members. And so we're very excited that they are taking advantage of this learning to figure out about safety planning, domestic violence, helping a friend, again, those very important topics. And again, that's a private sector and NGO partnership, which is, everything I've discussed is all in partnership. Next. And lastly, I want to talk just a little bit about some of our other COVID-19 efforts around gender-based violence. We've partnered with the governments of Chile and Argentina to add WhatsApp, basically front ends to their helplines. So instead of having to call to talk to a helpline, you could text via WhatsApp and reach a helpline counselor funded by the government in Chile and Argentina. And so we were very proud to help them integrate WhatsApp chat bots and chat functionality. We're also working in other countries to add messenger bots where you can ask for what are the hours, where's the nearest shelter, I need help, what is a safety plan, when is the courthouse open, those types of things. A messenger bot can have help with frequently asked questions, and it's very interactive. We've been doing trainings to make sure that as people are switching to WhatsApp and Messenger chat functionality, that they know how to take what they're used to doing in person and change those services, which are quite different when you do it by text. One of the things we found is that when people do chat and text-based counseling instead of by phone, is the conversations are usually much longer and sometimes much more intense. Sometimes survivors will disclose a lot more detail when it's text, when it's typed, instead of when it's spoken. And then we've been doing Facebook Live videos to really lift up the work of our NGO partners, because again, we know there are incredible civil society organizations working during this global pandemic to keep survivors of gender-based violence safe. And I am just very proud to be here. So next slide. So lastly, I just want to say Xie. Thank you for inviting me. I'm proud to be here.
Xie. Thank you very much, Cindy, for that that presentation on the work that Facebook is doing to combat the shadow pandemic of domestic violence in particular, as countries are in lockdown or following work from home practices. We're very encouraged to learn about the Helpline Project, which the Global Network of Women's Shelters will soon be announcing to the world, and interested to learn that texting can be a more detailed way to do counseling. Okay, our third speaker now is Mr. Doug Rutzen. Doug is the president and CEO of the International Center for Not-for-Profit Law in the US. He also serves in many advisory roles with the UN, OECD, and USAID. And in the past, upon Czechoslovakia's transition to democracy, Doug was a legal advisor to the Czech Parliament, where he helped draft the country's non-profit laws. So we'll be very interested to hear his perspective on cooperations and partnerships between CSOs, corporations, and governments in the COVID world. Doug, I'll hand over to you.
Thank you, Mr. Carlisle. Thank you also to Taiwan. A good morning, and it's an honor to join you and to have this opportunity to learn from you all. And toward that end, I'll actually condense my comments so we have a chance for discussion. For those whom I met during my last trip to Taiwan, you know that we work on the legal framework for civil society, digital rights, and philanthropy around the world. And since we last met in March, we launched a tracker of government responses to the pandemic that affect civic freedoms and human rights, especially focused on emergency measures. We did this in partnership with the European Center for Not-for-Profit Law and Fionnula Nieline, the UN Special Rapporteur on protecting human rights while countering terrorism. During my brief remarks, I'll summarize some of our findings. Specifically, as of this morning, we've identified 380 measures in 159 countries that affect the ability of civil society to partner with governments in responding to the pandemic. And many of these initiatives overreach. What I'll do is I'll talk about 3 concentric circles of challenges. I'll then share some good news. First, the challenges. In the innermost circle, we have these measures that restrict civil society's direct engagement with government or as an independent development actor in its own right to respond to the pandemic. 3 typologies of constraint. First, some countries are explicitly restricting the ability of civil society staff to deliver pandemic responses and services. Just a couple of examples from our research. In Rwanda, the authorities actually arrested aid workers for violating social distancing orders when they were distributing food in a low-income neighborhood. In Cameroon, workers were arrested for handing out free protective masks and sanitizing gel and now face 4 years in prison. And in another country, movement restrictions block the ability of humanitarian organizations and staff from providing COVID medical aid and relief. What's the issue? The issue is many countries will have exceptions for essential workers, but they don't think civil society staff are essential. Problem number one. Two, access to information. We need information in order to carry out our programs. Yet countries like El Salvador and Georgia and others actually suspended all access to information laws in response to the pandemic. And other countries, we find the government interfering with public health experts and punishing whistleblowers who seek to share independent information about the pandemic. Without that information, it's really hard for us to engage. That's problem two. Final problem in this circle, participation. Obviously, we want civil society to be engaged in all phases of the pandemic response, everything from identifying needs to designing programs to carrying out services and assessing results. Yet in too many countries, the government actually excludes us from the pandemic response. They view this as being the sole province of the government. I know this isn't the case in Taiwan or Korea, as we heard, but in others it is. And the unintentional consequence of going online for participation is that in many countries we end up further marginalizing the communities and the individuals on the wrong side of the digital divide. So we're doing lots of work trying to figure out how do we ensure that we don't unintentionally marginalize communities who need to participate, in some sense, the most. So we have that inner circle, the ability of civil society to directly engage in the pandemic response. We then have a second circle. This is what I would call sort of measures adopted during the pandemic that constrain civic freedom and digital rights. Again, just three brief typologies. One, free expression. We find that government after government is penalizing criticism and dissent. In many countries, they do that by passing fake news laws. But as we talked about during my last trip to Taiwan, there's a real challenge when other countries do that. Because who determines what's true? In these other countries, it's the government. And that's fundamentally the problem. They're the arbiter of truth. And they use that to censor independent voices. From places including Zimbabwe and others, there are criminal penalties if you share information that the government determines to be untrue. In Jordan, it's a criminal offense to even use satire to make a comment about the government's response to the pandemic. And in another country in which we work, 200 people, including journalists and activists, have been prosecuted for supposedly spreading fake news relating to the pandemic and the response. Two, as we look at this issue of civic freedom, we find a whole series of measures restricting peaceful protests and assembly. What we find around the world, including my own country, is that the pandemic ignited a tinderbox of societal concern. It might be related to racial justice, or public health, or elections. The issue is country dependent. But if you look at the global data, there's actually an uptick in protests. And for every action, there's an equal and opposite reaction. Governments are seeking to repress peaceful protests. A good example is Hong Kong. Authorities are arresting people for holding illegal assemblies, and recently arresting people for wearing masks during assemblies, because they argue that you can't be wearing a mask because it obscures your face. It might make it a little harder to catch you through facial recognition technology as well. So in the second circle, we have issues around free expression, the right to peaceful assembly, and the third and final issue I'll address in this is the issue of right to privacy. But I know this is complicated. We find governments that want to have COVID apps in order for contact tracing, sort of ensure people are keeping quarantine. I get that. But in far too many countries, I think of Poland, for example, people have to download a home quarantine app. If you don't, you can be visited by the police. And you're even in some countries required to upload selfies, which is fed in the facial recognition technology. I fear that when we look back in 5 years and we say, what's the primary human rights impact of the pandemic? I think it will be around peaceful, free expression, and also surveillance. Governments will not want to undo some of these invasive surveillance techniques that they have rolled out during the pandemic. So that's the middle circle. It's around civic freedom. Third and finally, we find that there's broader pressure on democracy as a result of the pandemic. And just 3 brief issues. 1, emergency powers that concentrate power in the executive branch. Some countries have suspended parliament. Others have suspended judicial proceedings or said that lawyers are not essential. There may be a joke there, but as a lawyer, I don't make that joke. And we find that what we're doing is eroding democratic checks and balances. 2, we're finding governments that are securitizing, one might even say militarizing, the response to COVID. Some governments are declaring a war on COVID. The US Treasury Department put out a statement talking about the global war on COVID. This concerns me. It reminds me of the rhetoric after September 11th. It makes it very easy to convince citizens to trade off human rights and democracy in the name of protection, in this case, public health. Well, a balance is necessary. When we securitize the response, bad things often happen. And finally, there's a competition over norms. You know this better than I. There are certain authoritarian governments that are saying the authoritarian approach is the only way to defeat the pandemic. But thankfully, Taiwan and other countries have shown that it's possible, in fact, to protect democracy and to protect public health. And building on what Mr. Chen, Dr. Chen said, there's an important issue around public trust. What we find in certain countries, and I think of Digital Minister Tang's point about 3 Fs, having a fast, fair, and fun response to COVID, is that you find voluntary compliance with measures, those unsung heroes, in some sense, because they trust their public institutions. But they also trust one another, that one wears a mask not necessarily to protect yourself, but to protect those around you, to protect your community. And so you might find in these countries people stockpiling masks, face masks, disinfectant, and PPE. In my country, we stockpile guns and ammunition. It says something about our country that instead of seeking to protect the other, we seek to protect ourselves. And why do we do that? Because we don't have the same level of trust in our public institutions, or I might add, because of our polarized political environment, in one another. So I think there's an important conversation that needs to be had on how we can address each of these rings, because they all impact the role of civil society in the pandemic response. We must look at that innermost ring, the service delivery ring around protecting the space for civil society to engage in the pandemic response. We must look at the second ring, protecting fundamental freedoms like free expression or the right to privacy. And we must look at that third ring, the issue about the impact of the pandemic on democracy and human rights. And that's why I'm absolutely delighted to have this opportunity to engage with you today, because as the experience of Taiwan has shown, it is possible, in fact, to keep both public health and civic space informed, healthy, and vibrant. So thank you for allowing me to join you today. I appreciate your time. I look forward to your questions. And most importantly, I look forward to the opportunity to learn from you. Thank you.
Thank you very much. Thank you very much, Doug, for that very interesting overview of the civil society view of the COVID crisis, from the challenges to participation of CSOs in the recovery process, to the attacks on freedom of speech and democracy as well. And finally, he talked about the narrative, the way we talk about COVID, not treating it as a war, but as something that we need to do together, to work together in partnerships. Thank you also for saying nice things about Taiwan. We're not perfect, I should say. There have been a lot of questions here about the way the government tracks people's cell phones. So that also raises issues of personal freedom, which perhaps we can talk about when we challenge Dr. Chen in the question and answer session later. But before we come to that, I'd like to introduce our final speaker today, who's Soawapak Hinjoy, Dr. Soawapak Hinjoy. She's the director of the Office of International Cooperation at the Department of Disease Control in Thailand. Dr. Hinjoy has a background in veterinary medicine, and she pursued her education in public health. She also graduated from Johns Hopkins University with public health. So she has a dual role at the CDC in Thailand, as well as being a veterinary officer at the Bureau of Epidemiology, Department of Disease Control. She's also the director of the Office of International Cooperation. So I'd be very interested to hear what Soawapak has to report from Thailand. And if she can, I would be interested to hear her comment about the challenges Thailand is facing with its own transfer to democracy in the current climate. So, Soawapak, without further ado, I'd like to hand over to you.
Okay, good morning, everyone. And it's our pleasure to share some experiences from Thailand that how we can engage different partnerships to respond within the COVID-19 situation. Next slide, please. Okay, next slide.
Yep.
Okay. Okay, for the next slide, I would like to show you about the whole picture of the COVID-19 situation in Thailand. And from this picture, from this figure, Thailand, we can detect in the case of the COVID-19 since at the beginning of January. And then in the mid of March, we have a dramatically increasing trend of the COVID-19 case in Thailand, because this is kind of like a local spread. This is a big outbreak in the many clusters that occur in the boxing stadium and also in the nightclub or the pub and the restaurant. During that time, most of the people very concerned, and we have a lot of news that share around in the social media. And in the 26th March, the Thai government, we deliver emergency declare that across the country about the lockdown, and we produce a lot of the measure that how to contain the disease. Even though you can see the figure that after we using the law enforcement, the case is dramatically decreased. And now in the most of we course on in the airport, airport and seaport. And you can see that after we launched in the law enforcement emergency declare, and we use Communicable Disease Act to contain the disease. The most case that occur after in April until now is most of them from the outside of the country. And now after that, when the situation is improved, we can see that we release, we call it the relaxing measure to help the people to get into the normal life, but keeping the momentum of social distancing and wearing the mask at all time when they will like go outside of the residence. Okay, next slide, please. Okay, this is kind of like the picture that show you in the how the most important thing that this is how we strengthen the disease surveillance in Thailand. We focus in key places. The first one at the point of entry. Okay, in the ground port, airport, and seaport. We set like a thermal scan, and also we train the point of entry officer to help us to detect any abnormal event. And also we have like a checkpoint. Even they can detect some we calling the patient and the investigation, the suspected case. They bring the person back to our track to get in the appropriate treatment. And also we train in our immigration, we work within the immigration office to help us in the term of the detect of the patient and the investigation, or we call the PUI. But I think that everyone knows that in the screening protocol at the point of entry is cannot guarantee 100%. So we work within the surveillance, we strengthen the surveillance system in the hospital. At the hospital, because it's this disease, it is not only for the patient cannot be detected as in the government hospital. We know that the private hospital is just like a hotspot that will be like another part to help us to strengthen the surveillance system and help us to detect the disease. So we work within the private hospital association to deliver case definition, to produce the guideline for the clinical practice guideline, and help all like the healthcare officer and also medical doctor, both government and private sector, to help us in the term of the report and channel how they can share information and detect the case. And the last station, this is a community. Regarding we call the surveillance, community-based surveillance. In Thailand, we have in the long establishment of the healthcare volunteer and the health volunteer. That means that each village of Thailand, we have health volunteer, allow like 1 or 2 health volunteers per village. So this volunteer can help us to detect the case, to report any suspected event to the upper level at the health facility. And also they can help us to give education, how to prevent the disease for the village. Okay, next slide, please. Okay, this kind of like a strategy that we use this to manage the COVID-19. We call it the 6C strategy. The first thing is capture. Okay, I already tell in the previous slide that we very concerned about the early detection, and also the capture. We set this kind of the early detection in the all point of entries, and we know that the most sensitive one is not at the airport but in the ground port, and also we have in the temporary ground port and also permanent ground port that is maybe easy for the people can across around the border area. So we have to strengthen a lot of things in the term of surveillance and the laboratory capacity in the ground port around the country. So for the second C, the case management, this is we work a lot within the private association, and also we have like sharing experiences within our neighboring country as well. And we have in the sharing experience on the term of the clinical management via the platform of we call Jaeeun. And we have with this kind of the video conference within our neighboring countries and also within the Jaeeun platform. And the third C is the contact tracing. This is most important thing, because if we cannot trace back what in the primary case, the index case, and how many low high risk contact or the low risk contact is difficult that in the to contain the disease. So we invest some in the term of innovation and application in the term of the contact tracing. And the fourth thing is communication. We appoint the spokesperson to announce any health education, any news, the situation to our people every day via in the governmental channel. It is not only governmental channels, but we work within the other NGOs and also with the private sector, because we know that in the social media from that produced by the NGO or in the private channel, this is very helpful. They know what's in the target audience they want, so we work with them to distribute our in the infographics on other FNFs in our target audience. And also the fifth C, this is a community participation and law enforcement. Okay, as I told you at the beginning, that we have the health volunteer, and also we have to use in our emergency declare and law enforcement is termed up in the Communicable Disease Act to help us to contain the disease. And the last thing, this is the coordination and information. In Thailand, we have the center that in the gather data from the different districts. And also the chairperson of this center, this is the Prime Minister. So this center have authority to get information and synthesize the information and publish to our people. This is very important that we have to work within across the ministry and also within the private sector and also within the UN organization as well. Okay, next slide, please. And okay, the last in the couple months, we have been reviewed by our external reviewer that in the initiated by the WHO and the WHO Thailand. This is a coordinating unit to help us to review what we have, what we went well for the response to COVID-19 and what we went less well for the COVID-19. And this kind of the summary of the result of how Thailand went well on the COVID-19 response, and I will give you some example. That is kind of in the Thailand, we have in the robust medical and public health system because we have established in the infrastructure to respond to COVID-19. It's just not in the central level, but deep down to in the community level. And also we learn a lot from the previous outbreak. It's just like a SARS, even influenza, a Zika, MERS. That means we know how we have to engage within the different stakeholders and how we have to work together within the people to release any measure that the people can comply within our guidelines. And also we have good under the early screening and activating activating the EOC. Because we activate in the Emergency Operations Center on the 4th January. That means we activating the EOC in the early phase of the pandemic. And so we have kind of like a flexible and adaptive management system. Next slide, please. This is another student point. Next slide. Okay. We also have kind of like a rebuilding capacity. We have in the program that we call in the field epidemiology training program. And now this is more than 50 years that we established this kind of the program. So our epidemiologists have been also like a professional training, and also we train for the intermediate training program for provincial epidemiology as well. And also we got a lot of engagement from the public engagement and also cooperation from them, from the private and also from the other in the term of the bilateral cooperation with other countries as well. And also we have we use the concept of the whole of government and whole of society that under authority of our highest level of the policy maker. and we have the active communication within our people. Next slide, please. And this is
2 minutes left, Soawapak. 2 more minutes.
Yeah, this is the next slide, please. Okay, this is kind of like an integration plan that we use in the multilateral cooperation. And you can see from the picture that we work within the university and also within the private that we set like the station that the people, even they feel unwell and they suspect for the disease, they can drive to and get the sample and collect the sample to be tested. And so that's meaning the multisectoral collaboration is our keyword. Okay, and the last slide, next slide, please. Okay, this is something that we have to be improved in our system. It's kind of like a near-term improvement. For the I think that the important that in the quarantine facility, we know that in the quarantine facility, this is the key point that is how we can contain disease. And now we just only have like state quarantine that most of them in the Bangkok, in the suburban. But also we have in the other quarantine facility that we call alternative state quarantine. But we need to expand more. And so for in the other provinces, we need to expand it in the quarantine facility to the other provinces as well. And also integrated data system that to gather data from the different sectors is very important. So this thing that we bring this point and we are, and I think the last slide, this is, okay, last slide, next slide please. Okay, this is kind of like all in our experiences and what we have done for the responses for the COVID-19 in Thailand. Thank you very much.
Thank you very much, Soawapak, for that very interesting presentation on the Thailand government's robust response to the COVID-19 crisis. Now, we have 20 minutes left to this session. 20 minutes. So we have lots of time for discussion. So if I can ask Dr. Chen to come to the front again, and I'll take the first question. So we've heard, yes. Could you introduce yourself and keep your question brief, please?
Okay, my name is Lisa. I have asked a question yesterday. Right now, I'm concerned about vaccine because we are a democracy country. So it's our human right to say I want to have vaccine or not. That's the question. Thank you.
Okay, I think that the vaccine development for the time being is going smoothly. A lot of big pharmaceutical company in the world, they already have this vaccine available and enter into this clinical trial phase 3. So I believe the earliest one, maybe at the end of this year, one of the company will have this vaccine been approved. And I believe that in the coming winter, the more and more companies will have this vaccine finish their clinical trial phase 3 and will be available for the whole world. I think with regard to the vaccine, we have to concern about the so-called vaccine nationalism. A lot of national governments are trying to hold all this vaccine for their own people, and they don't want to share with other countries. So that's fortunately, recently we have organizations such as CEPI and COVAX. They try to ask this different vaccine company to put this on their production and then to request for international applications, and they set up the priority for that. And vaccine cannot be produced in a mass volume within one day. So our vaccine will come manufactured day by day. So we definitely have to set up the priority for immunization. There's, for instance, there's a healthcare worker, and that's quarantine people. They have to in healthcare quarantine workers, they have to be vaccinated first, and also for the elderly and those who have this chronic diseases, and workers in important government agency, for instance, this policemen and also the soldiers, they are also important to be vaccinated. And then there's people have this public contact, such as the bus drivers and other workers. I think we have to prioritize the priority. And I agree with you that we have to ensure that everyone in this country and also in the whole world have the vaccine available for them. And it has to be very affordable and with a low price. And some of these international NGOs are helping that. For instance, there's an Bill and Melinda Foundation, Gates Foundations, they are helping. And also I just mentioned about CEPI is helping us. So we wish that in coming years, the vaccine will be more available for all the peoples.
Sorry, my question is, be a human right, can I say no to vaccine?
Oh, okay, of course, you may have the right to say no. You don't want to receive it. Yeah, sure.
Thank you. Yes, yes, it's very important to involve CSOs if and when the vaccine does come out. There's a big danger that it will be politicized and become used as a tool by governments. Soawapak or anyone else would like to comment on the issue of vaccines?
Yeah, I agree that in the Dr. Chen just discussed about the vaccine, and in Thailand, the same. We are in the part. We have like the committee that to consider what the vaccine, and we have National Vaccine Institute, and so actually in the National Vaccine Institute, we are so close together within the Korean Vaccine Institute as well, and also we have worked within the WHO. So for in the phase, okay, so we divide the phase of the vaccine in the different phase, but for in the first thing, we again that it's hard that to predict that when the vaccine can be deliverable to the all people. But so that the first priority that we have to keep the education, to keep the momentum of the people that don't let your guard down. So social distancing and like mask and education, how they can prevent the COVID-19 is to be like the first priority that we have to just like give the immunization for the people. I think this is the first important thing that we have to keep the moment up in the momentum of education to the people.
Yeah, thank you very much. That's very important. We mustn't forget education. Any other questions? Yes, Nina.
Thank you. My question is from the presentation from Korea and the Douglas. So I'm very, I think it's very important that the CSO cannot be left out when the government to do the COVID-19 strategy and planning. And I know that Korean do very good job that from your presentation, I found that the Korean government can hear your voice. So I would like to ask the Dr. Chen, so when the Taiwan government do their strategy in the COVID-19 prevention, how you include the CSO's voice into your strategy? Thank you.
I think that in Taiwan, what the CCC has been doing is that they have a daily briefing, press conference, and I think that through this kind of interaction with this mass media, I think some of the opinions has been reflected to this, the government, and in this our government's CCC, and we have so-called there's an experts advice committee, And in the expert advisory committee, not only there's health personnel involved, there are also some of the sociologists and social workers that are involved. But I think that NGOs opinions are also very important, and those are no so-called there's a regular way to get these opinions. I think that if there's an NGO have any kind of opinions, and you are welcome. I'm not in the government now, but I think that they welcome all these comments or the suggestions and recommendations from this NGO to CCC. You can send this suggestion recommendations to CCC. They are quite open, and if you look at this daily briefing, basically they receive any kind of challenges and critiques and also comments.
Yeah, thank you. NGOs in Taiwan were feeling frustrated in the early days of the COVID crisis because the distribution of PPEs, you mentioned the millions of masks, but that was between government to government, so NGOs weren't able to get involved in that. So I'd like to turn that to the other panelists. What strategies can NGOs use if they find they're frustrated in making cooperations and partnerships with governments and corporations as well? So Cindy could also comment on that. We see huge funds available from Twitter and things like this, but somehow it's beyond our reach. What strategies can NGOs do to make their partnerships more impactful? Who would like to answer that first?
I can answer.
Sure.
I can speak to my previous job. Right before I left the National Network to End Domestic Violence, we actually were able to combine the buying power of over 2,000 NGOs in the United States and purchase masks, hand sanitizer, wipes, and did that in bulk, and were able to purchase over 1 million items. But it was because we brought the buying power of all of these NGOs together into one purchase, and people got their own orders, they were mailed to them. But what we found in the US, especially back in April, May, and June, is we could not find supplies in the stores for the shelters that needed those masks and cleaning supplies desperately. Now it's much more accessible to find PPE, but back in May and June it was not. And so the national network worked with our entire network of shelters with a private company to sort of bulk buy resources. So it wasn't free, but at the same time our shelter said we're happy to buy the cleaning supplies, we just can't find it in the stores. This was back in June when we were really struggling. So I encourage NGOs to bond together and try to help each other wherever possible.
Doug.
Thank you. It's a wonderful question. So we just suggest a couple of ideas. One, in many countries, we find that civil society representatives are not just consulted, but they're formally part of policy-making bodies. And this is really important. It's also really important that it not be considered purely a technical exercise among sort of the government and civil society engaged in public health. What we find is that if you involve groups that are working on domestic violence or working with teachers, they'll know more about what some of their needs are, or children's issues and so forth, that they actually have an important perspective on where the needs are, how the response can most effectively be delivered, and then also can help with trust building with their communities. Final point on this, in terms of resources, which you mentioned, Mr. Carlisle, it's interesting, some countries have created special line items specifically for civil society. So Austria, for example, recognized the role of civil society in its pandemic response and allocated 700 million euro to support civil society's engagement. So I think that there's a way as well that you can help ensure that civil society has the resources necessary to be an effective partner.
Yeah, thank you. Jaeeun.
society use not...
Jaeeun, could you speak up a little? We're having trouble hearing you.
Okay. Can you hear me?
Yeah, it's a little bit faint.
Okay.
Loud as you can.
Yeah, okay. I think the civil society use not the unilateral ways, but the diverse way. So from the Korean perspectives, in this moment, we use several ways I already presented. So we try to reach to the government and to the public and the private sector, but also we also try to engagement with the global civil society. So we we put our efforts to bigger and bigger, and these efforts push our governments and other stakeholders to be partner with the civil society. Thank you.
Thank you. Thank you very much. Any other questions? Yes, at the back. You have a microphone in front of you on the table if you press that.
Hi.
Can you introduce yourself?
Sure. I'm Chien-jen. I am doing my master program at University College London. So I, too, just came back from the UK. And this is more of like a sharing of my experience. So my friend and I came back on the same day. And then he resides in New Taipei City, where I quarantine in Taoyuan. And we were asked to do different things in terms of like data collection and contact tracing and tracking. So he only received texts from CDC every day. And I, on the other hand, I have to, not in addition to texts from CDC, I also have to add someone online. So for the panelists who don't know what Line is basically like WhatsApp. And so I need to do two different things. I even don't know that why I'm asked to be at Line, like online. Like I don't know why I have to share my personal social media or like my personal app information. So I think what I see is just a bit like discrepancies between how different approaches in between different cities or like locally or like nationally. So this is a kind of like issue I want to raise. Like and up to date, I still don't know that if my information, like how the person is gonna use my line information. So I just want to raise that issue. Thank you.
Okay. Yeah, this is the man to ask.
I think, yeah, I think this is a very good question. With regard to this, keep this government hotline with the quarantine people and isolated people is the responsibility of our local government. And different local government have their own modification or revision of this central guideline. It's understandable. It really depends on the manpower and also the resources available to do this kind of support and care services. And so for your cases, I cannot answer because I don't know which city governments and local governments doing that. But I think that, yes, there's a debate that in this COVID-19 pandemic period, should we collect this personal telecommunication information for this COVID-19 containment? Even it's a debate in the CECC, Central Epidemic Command Center. And that's the reason why we just passed a law, a special law for COVID-19 containment. And during this pandemic area, the government may have the access of the telecommunication information for the sake of this COVID-19 containment and also to protect this the general public. And this permission is allowed only when there's a pandemic. And after the pandemic, people, the government, and even the CCC cannot have access of any personal information through this intercommunication cooperation. And I would like to share with you that using this kind of information, we can use this cell broadcast to warn more than 600,000 people and tell them that, oh, CJ, you have been in some restaurant and at the same time, there's a confirmed case there, so be careful of yourself and have this self-health management and so forth. So this kind of self-broadcasting is based on this kind of system. So it's an unusual way to use private telecommunication information. I think this is a very special occasion. And I would like also assure that there's privacy and confidentiality are very important, and we don't announce any kind of ID information, identifiable information of the individual. That's what we ask CCC to do. And of course, there's a lot of comment or something can be improved. You are welcome to send these suggestions to CCC. Thank you.
Yeah, this is a topic I'd like to ask the other speakers, especially Doug and Cindy, to comment on, and also I'll ask Soawapak and Jaeeun to say a few closing words as well. Where do you draw the line between privacy, confidentiality, and disease control? I'm sure Taiwanese government is not going to misuse our data, but on the other hand, 600,000 people were quite surprised that the government knew exactly where they were at what time. That's sent them a text and being tracked all the time. And what happens when the government is not so responsible, or is not as transparent as Taiwan? So Doug or Cindy, would you like to comment on that? And then, like I said, I'll ask Soawapak and Jaeeun to say a few closing words.
I have to say, but I'll be very brief. I think that the key issue here relates to the purposes for which the information is collected, who else it is shared with. We often find that there are assurances by the health authorities that they won't use it after the pandemic passes. But in fact, for enforcement, they've now shared it with the security forces, the police, for example, and they don't have the same guarantee. There's issues around the duration. So we might say you can't access it, but it's the information in some sense now sealed off. What I would say in terms of good practice, there's a Dutch COVID-19 app bill that's currently pending in the Netherlands Parliament, and it addresses all these issues. And I think it's quite an interesting model to help balance the interests in public health and human rights, specifically around COVID-19 apps. I'd be happy to share more information. We have an officer and a colleague who's been engaged on that.
Thank you. Yeah, I'd be interested in that. Cindy?
I don't know that I have much to add. I think it's a very complex issue, especially when different countries and different governments have different approaches. I do know that my former organization, the National Network to End Domestic Violence, has put out guidance for track and tracing best practices similar to what Doug talked about. So I'm very excited to see what the Netherlands app looks like. And just a last thank you, and Shia for including me.
Thank you. Soawapak, do you have some very brief words?
Yeah, and I told in my slide presentation that in the contact tracing, this is a key, like a priority that we can contain the disease. But when we say that contact tracing, that means we have to track the people, right? And where do you go and where did you have in the past history about the risk of exposure. That means they're concerned about that means the government have to know about their personal information. This is a kind of the problem, and we have to balance between a personal identification, personal information, and the information that useful for the investigation team. So we communicate with the people to understand how the information that we use for the contain the disease. And actually in the Communicable Disease Act, we also put in the one article that the people have to release information that is necessary for the health investigation team to contain the disease. So the important that the government need to make the people task how they can use the information for the contain the disease, but the government have to create a infrastructure and talk within the data scientists how they can make a security for the personal information,
Right.
not to
Thank
use
you.
for other purpose.
Thank you very much. Thank you. Jaeeun, very briefly.
Okay. I think the pandemic makes us focus on our safety first, but I think the supporting developing countries for infection prevention and treatment also means protecting us, because if we decide to start supporting developing country only after our domestic situation is under control, but we would miss the critical golden time to save lives. Thank you for listening.
Thank you. Thank you very much to all the panelists, and thank you for your very interesting questions. Let's give them a final round of applause. Thank you very much, everyone. And a big thank you to, especially to Doug and Cindy, who it's very late for them now. Thank you very much for staying up.